Hey everyone, happy Fibro Friday. I hope you all have taken great care of yourselves this week, and I hope that you continue it through the weekend. If you have been neglecting in your self-care in any way, please let today be the last day that is the case. Do something kind for yourself today. You deserve it, okay? Now, today's video is some research, and I like to go through the research a bit because there's a lot to parse out. There's so much thrown at you when you have any chronic illness or any kind of autoimmune condition, but especially when you have something that doesn't have a very clear root like fibromyalgia. You get a lot of data thrown at you, and you just kind of want to know, what can I do with all of this, because this is a lot, right? So let's get into it. There was a study coming out of Finland, and this is what I am going to be summarizing very roughly today. The name of the study is Heart Rate Variability Response to Cognitive Stress and Fibromyalgia are characterized by inadequate autonomous system stress responses. Okay, basically, your autonomic nervous system is behaving dysfunctionally, and that might be in some way telling us something about your fibromyalgia. No surprise there. Let's straighten this camera up because I think I'm a little crooked. There we go. I think that's better. So, as I stated, the study is out of Finland. The information to the study, because it is peer-reviewed research, will be in the description box below, along with the name of all of the authors, co-authors on this paper. So what you learn when you look through this paper is, first, that your autonomic nervous system dysfunction tends to happen when you have fibromyalgia. And the way that they generally assess this as a standalone condition is through heart rate variability tracking. Basically, they check your heart rate to see if it does what it's supposed to do when certain activities occur. Okay, so here's the trick. Most fibromyalgia patients have reduced heart rate variability. They don't have the highs and lows that they should. Things are closer to level, not exactly level, because level is flatline, death, right? But the variability is reduced. So you don't have these sharp swings, but you don't have normal swings either. So what you need to know is that heart rate variability, like I said, is reduced in many fibromyalgia patients, and most fibromyalgia patients have diminished sympathetic nervous system responses. Your sympathetic nervous system is your fight or flight. Basically, your average person with fibromyalgia, I won't say average, many people with fibromyalgia do not have proper fight or flight responses in their bodies, probably because they're exhausted. That's probably not it. But truly, the body is not responding like it needs to. There is systemic dysfunction going on. So, what the researchers tried to do is figure out this. If they put people into groups, people who'd been diagnosed with fibromyalgia, if they put them into groups based on their heart rate variability, as well as a few other factors, could they look at the pattern of heart rate variability and then determine what kind of therapies work best for a particular group? Okay. There was a lot of testing. The group was pretty small. It wasn't a huge group of people. I think there were like 50 or 70. I can't remember. The number of people tested don't matter because the sample size was small, okay? They were just trying it to see what they could come up with, okay? What they found was that they could cluster the people into 4 groups, okay? You had a normal group, of course, people with normal heart rate variability. Then you had a group and normal blood pressure, okay? You also had a group with elevated heart rate variability and elevated blood pressure, because these are 2 different things, right? Blood pressure is one thing, heart rate variability is another. Then you had a group with decreased heart rate variability, or decreased heart rate. I keep saying variability. For this part, it's not variability. It's normal, elevated heart rate and blood pressure, decreased heart rate and blood pressure. And then there was another group, which one of these factors was average all the way through, but it's elevated heart rate and blood pressure, but also high SCL, which is skin conductance level, literally how electric the skin is. That was another group that they found. Okay, so they clustered these groups based on the similarities, and then they started looking at the data to see what trends they noticed, because that's how all good research happens. What they noticed was that this research matched what they had seen before, confirming that decreased heart rate variability is very common in people with fibromyalgia. Also, they noticed that this correlates, like they've noticed before, it correlates with diminished sympathetic nervous system function. You're not getting the proper fight or flight going on. But they noticed that decreased heart rate, or they knew by other research that decreased heart rate variability is often found in people with anxiety and depression. Now, for those who are familiar with fibromyalgia, those two conditions, anxiety and depression, are often comorbidities. They usually happen at the same time as fibro. So, this creates a question here. If we know that decreased heart rate variability is usually an indicator of autonomic nervous system dysfunction, does that mean that autonomic nervous system dysfunction is a shared factor of both fibromyalgia and psychological issues? Because certainly 1 plus 1 will give you 2. But in this case, not always. Not always. There hasn't been enough research to say conclusively, yes, if your autonomic nervous system is dysfunctioning, that is absolutely a factor for your fibro as well as your psychological issues. And the reason why your fibro has some psychological issues on the side is because of this. And I'm going to just say ANS so I don't have to keep spelling out autonomic nervous system, that your fibro having a side of these issues is due to ANS, so, or ANS dysfunction. So it's a very fascinating study because they didn't get anything conclusive as far as what kind of therapies would work if you have elevated heart rate variability and high blood pressure, or decreased. But they did determine that this opens up other questions, which opens the path for additional research. In my opinion, and I am very, very lay person, I do find it interesting that for people with fibromyalgia that might be experiencing anxiety or depression along with their fibromyalgia, that their fight or flight is actually not elevated. I'm surprised that they have diminished responses, because when you're in the midst of those conditions, your responses don't feel diminished. They feel very, very heightened, which is interesting. If you're in the throes of it, it feels heightened. You feel like these things are quite grand. But when they observe it objectively with metrics and tools to observe how this is happening, it's actually diminished. So that lets me know that actually does track. Like, it's amazing to me, but it does track, because if your systems are dysfunctioning, then they are not communicating properly within the body. So what feels much more dramatic and much bigger is not that's not your brain getting the right signal from the body. The body's saying, we are doing this, and the brain is scrambling it and saying it's way worse than what it is. And so it's a very interesting thing to think of how these things work together. Again, I'm very much a layperson, and this is not medical advice. However, I would say, based on this study, and this is one study that has based its background and its I was going to say thesis, hypothesis on other studies. Based on that, I would say it is worth exploring how you can determine your heart rate variability, whether it's on the increase, decrease, or normal range, and going from there, figuring out whether treatments that resolve those things can help with your fibromyalgia symptoms. It could be a bit of a backdoor into your fibromyalgia diagnosis, if that is something that you are struggling with, because I know that is something that many people who have fibro have a hard time getting diagnosed. So and this does not mean that everyone who has fibro has this decreased heart rate variability. As a matter of fact, we know from this study that there was at least one group that displayed normal symptoms all the way around, right? So that group, of course, they didn't have the variability being elevated, like as far as elevated heart rate, nor do they have a diminished or decreased heart rate. They were average. So you would think, okay, maybe this is not the most reliable metric, but it is the most used metric for determining autonomic system, autonomic nervous system, ANS dysfunction. So if you are experiencing some of the other symptoms that go with ANS dysfunction, like dry eyes or Raynaud's syndrome, those things are related to ANS dysfunction. If you have not gone through heart rate variability tracking, you could certainly ask your doctor for that. You could ask a specialist for that as well, possibly even a cardiologist, I would recommend. But your standard primary care physician may be able to do this for you as well. I would imagine some measure of it can probably be done with with certain primary care physicians. But consider that. See if your heart rate variability, not your heart rate low, but your variability, see if that is low or below the normal range, and use that kind of as a basis to see if maybe ANS dysfunction could be a possible factor in what's going on with you. It also may be worthwhile, even if you don't have fibromyalgia, you don't suspect that you do, but maybe you suspect you're going through anxiety or depression issues, but you have some other symptoms that are kind of weird. If you're having a hard time kind of pinpointing what's going on, this might be something to consider. And knowing that the treatments for ANS dysfunction may give you overall relief might be something useful to you. So I wandered, I took you on a trip, but I hope that this was somewhat helpful. Learning more about heart rate variability, ANS dysfunction, and how these two things relate to fibromyalgia, as well as certain psychological issues. It could be a tool in your toolbox where you could figure out some of what's going on with you health wise if you're someone who's suffering through this right now. So I hope that helps. Again, links in the description box for your convenience, because I know that this is a heavier topic. And I hate to put quotes around it. I don't think it's heavy. I just think that if you are in the throes of a condition, it's a lot more to process. I say, if you like reading through charts and data, have at. I read through them, so you don't have to. You can read some of the introduction, background, and go right to the discussion and conclusion and get a lot of the details that I got. So that's it. Have any of you had your heart rate variability measured? What did you learn? Did it, was it part of some other process? Did it give you some insights that you weren't expecting? So, yeah, I want to hear all of that. If you know those details, I'd love to know about them too, if you're willing to share. And if you have questions, or if you know of some research that you want me to read through and to talk about on this channel, please let me know. I've got some time in the weeks to come, and I can certainly do some reading. So, thanks again for stopping by. Please have a great weekend, and I will talk to you all soon. Bye bye.